Hello and welcome to Medical Dialogue Journal Club, your daily dose of health and medical news. I am Dr. BP Rahul and I am going to talk about statin use tied to lower risk of acute on-chronic liver failure in cirrhosis patients. Statin use is significantly associated with reduced development of high-grade acute on-chronic liver failure in patients with cirrhosis, according to the results from a large retrospective cohort study that appears in the Journal of Hepatology. Considering the need to identify therapies that prevent the development of chronic liver failure in cirrhosis patients, Nadeem Mahmood from Department of Medicine, Corporal Michael J. Crescent, VA Medical Center, Philadelphia, USA, and colleagues aim to evaluate the association between statin exposure and the risk developing ACLF in a large national cohort of patients with cirrhosis. For this purpose, researchers performed a retrospective cohort study of patients diagnosed with cirrhosis within the Veterans Health Administration between 2008 and 2018. Based on the statin exposure, patients were stratified into three groups: statin naive, existing statin users, and new statin initiators. To comprehensively address potential confounding in estimating the association between time-updated statin exposure and the first occurrence of high-grade ACLF, Cox proportional hazards regression models with inverse probability treatment weighing the marginal structural models were utilized. Based on the study, the researchers reported the following findings. The cohort included 84,963 patients, of whom 26.9% were on statin at a baseline. A total of 8,558, that is 10.1% patients with cirrhosis were hospitalized with high-grade acute-on-chronic liver failure over a median follow-up time of 51.6 months. Time-updated statin use was associated with a significant reduction in hazard of developing acute-on-chronic liver failure. Increasing doses of statin were associated with progressively reduced hazard of developing acute-on-chronic liver failure. Every additional 5 months of statin exposure was associated with 9% reduced hazard of high-grade acute-on-chronic liver failure. To conclude, the results of this study support the promising role that statins may play in future prevention of acute and chronic liver failure in patients with cirrhosis. That's all for today. Stay tuned to Medical Dialogues for latest updates.
Never miss a medical update from Medical Dialogues. Like, subscribe, and press the bell icon.